All right. All right, y'all. Good evening. Thank you so much for joining us. Welcome to our panel discussion on birthing justice, pregnancy, and infant loss. I am Christy Love, president of the Association of Black Social Workers, Metro DC chapter. Our goal as a chapter is to liberate the Black community. In some of the ways we do that is through advocacy and education. October, as you know, is Breast Cancer Awareness Month, Domestic Violence and Intimate Partner Violence Awareness Month, and Infant and Pregnancy Loss Awareness Month. This year, our focus is pregnancy and infant loss awareness. We want to shed light on Black maternal health and honor those who have experienced loss. Today, we have a panel of experts in the field who will share their work around maternal health. Before we get started, let us ground ourselves using the NABSW Stay on Code campaign. We will share a few of the ideals from our code of ethics that help us as Black social workers stay on code. As Black social workers, we commit ourselves collectively to the interest of our Black brethren, and as individuals subscribe to the following statements. I regard as my primary obligation the welfare of the Black individual, Black family, and Black community, and will engage in action for improving social conditions. I give precedence to this mission over my personal interest. I adopt the concept of a Black extended family and embrace all Black people as my brothers and sisters, making no distinction between their destiny and my own. Again, the Association of Black Social Workers strives to stay on code through living out the code of ethics. Again, we're here today to honor and recognize pregnancy and infant loss. And just a little information about pregnancy loss. In 2002, on October 15th, that day became the observance day for Pregnancy and Infant Loss Remembrance Day. And so if you remember next year, October 15th, I think they light candle. It's so many different things. And whatever if any of you all have experienced loss, just make sure you take care of yourself and you show ways to honor and to remember, and also share your story, because you never know how your story can help others. So let's get into it, y'all. So we are grateful to to all of you all and our sponsor, Health Justice. It is not Health Justice. It is Healing Justice. Is that South Beach, Simone?
Santa Barbara.
Santa Barbara, and our panelists. I will introduce Simone, who will then introduce our speakers. So, Simone Aquila, her pronouns are she and her, is a licensed graduate social worker and received her degree from the Howard University School of Social Work. She is an inaugural John and Barbara Jacob Social Justice Fellow and an alum of the HBCU Center for Excellence in Behavioral Health and the Substance Abuse and Mental Health Services Administration. Simone is a co-founder of two Black-centered organizing collectives, Healing Justice Santa Barbara and Juneteenth Santa Barbara, earning experience in organizing and systems building. Simone is passionate about prenatal mental health, and she currently supports birthing and parenting people through a DC-based psychotherapy private practice. As the parent of two young children, Simone affirms the radical work of mothering and believes that all are needed to create the communities we deserve. Simone, you have the floor.
Thank you, Christy, and appreciation to you. I just want to say, I love seeing all y'all's pictures, all the beautiful faces, all the different shades. So thank you for being here. We know there are so many different demands on your time. And so you all joining, being present for this conversation is touching and moving, and we're grateful for you and your presence. As Christy mentioned, I'm Simone. I'm one of the co-founders of Healing Justice Santa Barbara. We're one of the sponsors for tonight because it was important to us to make sure that we really make sure that our budgets are priority statements, right? And so if we say that we care about Black people and Black families, that also means that we are paying Black people to share their knowledge and expertise and their stories. And so we're really happy to be one of the sponsors and providing stipends for each of the speakers that are here today. Before I get into introducing the beautiful panelists, I just want to make sure that I also offer a visual description as the way that I practice disability justice. So I am a dark-skinned Black woman. I have locks that go a little across my chin. I won't lie, because I was trying to claim a little bit more inches, but it's okay. I have gold hoops on today, and I am wearing a shirt that actually says Healing Justice on it. And if you can't tell, I am smiling while I am talking because I am so grateful for this community. I should also add that I am a proud member under Miss Christie of the Association of Black Social Workers. And you heard in the bio that little tidbit about working for a private practice. And now I got to shout out Siobhan because I don't just work for any practice. Okay, I work for Siobhan's practice, who was on this panel at Acoma. So again, grateful for each of you. I will go ahead and get into introducing each of our wonderful speakers. So the first, I'll go ahead and start with Ms. Siobhan, she, her pronouns, a licensed professional counselor, licensed clinical professional counselor, and national certified perinatal mental health therapist. She's licensed to practice in DC and also a national certified counselor and clinical professional counselor in the state of Maryland. So we have to say both so that you know she is in multiple places because that's important, right? We know that she is a national certified perinatal mental health therapist by Postpartum Support International. She's a board approved clinical supervisor by the Maryland Board of Professional Counselors and Therapists. And she has been licensed to practice professional counseling for more than 11 years. Her practice, Acoma Counseling Concepts, centers and affirms birthing people, and she also supports folks aged 16 years and up. She uses cognitive behavioral therapy and person-centered theoretical orientation. She also uses solution focus in her personal therapy. She specializes in maternal mental health counseling for mothers and mothers with perinatal disorders, including postpartum depression, fertility issues, miscarriage, and postpartum anxiety. She's completed postgraduate certificate training in maternal mental health counseling, again, via Postpartum Support International in Mary Centers Clinic in DC. She's also part of the Champions Project in Washington, D.C. So we thank Siobhan for being here with us today, for sharing her knowledge and expertise. And certainly, if you're wanting to learn more about her work and practice, certainly follow up with the Acoma Counseling Concepts. The next person I'll move over to is Dominique Jones, also she, her, birth advocate, childbirth educator, doula, and lactation specialist. So Dominique, owner and CEO of Mama, M-A-M-A, Mom's Advocate and Maternal Advisor, is a Black mother of 3 young girls aged 1, 4, and 5, who knows firsthand how scary pregnancy, birth, and the thought of motherhood can be. She notes that often women lack the support and encouragement needed to have the type of birth they desire. Women embarking on their journey to motherhood can feel unsafe, unheard, and unsupported during their pregnancy, and these feelings are often exacerbated once baby arrives. Dominique adds that an already scary time has certainly been made more terrifying by different aspects of the COVID-19 pandemic. And so Dominique created MAMA, Mama, to provide safe space where women are heard and supported, and provided evidence-based information to help them make informed decisions and advocate for the care that they want and deserve. Mama offers a full spectrum of virtual services for women from their pregnancy throughout their postpartum experiences, including childbirth classes, doula services, and lactation counseling. Dominique's vision to see non-judgmental, compassionate birth care services and equitable birth outcomes for all mothers and families. That's at the root of what they do at Mama, M-A-M-A. Next, we have Hadassah, she, they pronouns, a maternal health consultant, a student midwife, and doula. Hadassah, also known as Dasa Doula, is a mother of a college student and wife to a supportive partner. She is originally from the Bronx, New York. Hadassah has spent over 15 years working in nonprofit agencies supporting folks with mental health challenges in New York. Hadassah is incredibly passionate about reproductive justice and educating the community on their options in and outside of the hospital. Over the past few years, DAS has made a diligent effort to help birthing people access doula support, childbirth education, and free or low-cost resources while centering Black and Black Indigenous people of color And she's been really intentional about this in moving to PG County. Hadassah has been supporting families as a full spectrum doula, Lamaze educator, placenta encapsulator, and maternal health consultant. She completed her clinical training to become a certified professional midwife in November of 2022. So congratulations. And she'll be pursuing licensure after they pass the national NARM exam. Hadassah intends to join the small number of Black out-of-hospital licensed midwives serving Maryland, DC, and Northern Virginia. So already I'm like, the speakers, hopefully you all are seeing this. There's a lot of expertise, a lot of love and joy and intention in this work. And last but not least, I want to make sure that I introduce the host. So Miss Christy Love, also she, her pronouns, as you heard before, president of NABSW Metro DC chapter, also MSW moderator, event coordinator, and social justice advocate. Christy is a native of Chattanooga, Tennessee, a lifelong learner who strives through activism and community service. She's also known as K Love, an alumna of Howard. We've already covered all the Howard love and Lipscomb University. As an event coordinator and also invested in adult education at Community of Hope DC, she leads a team of employment specialists who provide essential tools needed to ensure success in the interview process, also teaches soft skills that will help individuals maintain and grow within a company. In the community, Christy serves as a president of Association of Black Social Workers, Metro DC chapter, where she strives to liberate the Black community through advocacy, education, research, and human service delivery. She's also a member of the DC Black United Front and With Great Care LLC. Christy is a natural leader with the ability to build rapport with individuals, leaders, volunteers, and community organizations. She has over 15 years of professional experience and is recognized by colleagues as a wonderful professional who is also dedicated, patient, flexible, and an active listener. She has an extensive background in workforce development, career development training, group facilitation, case management, and event planning. Christy is a social justice advocate and moderator who will inspire you to do all things with great care, purpose, and intention. So with that, again, we are so grateful to each of our panelists. If I can mention again, just for folks who may need a visual description of each of the folks here, they're all beautiful, beautiful Black folks of different shades. The hairstyles, I mean, it's just given all the things, whether it's beautiful locks that I see, updos that are here, curls popping everywhere. It's beautiful. And so again, I am so grateful to each of the panelists and for each of you for joining. We certainly appreciate the community that we're building together here.
Wow, can we give Simone a round of applause, please? Like, thank you. And one, I forgot she was going to introduce me, which I never get. And thank you. This was awesome. Thank you so much, Simone. She is definitely a behind the scenes person, but will definitely show up in the spotlight. So she has definitely helped us put this together. So thank you, Simone, for introducing our panelists. So I appreciate that. Again, thank y'all for coming for a serious conversation, but a needed conversation. And it's going to flow and we're going to have fun, but hope you gain some education, more knowledge, and that you feel empowered to share your story or other folks' story, and just share some education from what you'll learn from our experts. So, all right, ladies, panelists, y'all ready? Yes? Okay, good, good. All right, so each of you all will have 2 to 3 minutes on this first question, and then we'll just have a great conversation. And because I can only see Simone the way I have my screen, Siobhan, I'm gonna just say you can start it off. So, how and why did you become an advocate for Black maternal health?
Well, actually, working at your current place of employment partially inspired me because at the time I was screening patients as part of their primary care, their prenatal and postpartum visits. And one of the things that I was seeing was that I was only given 5 minutes to screen them, not just me, but anybody else. And I was noticing like these very high rates of Black moms that were scoring positive. But then once I thought about, well, where can I go to do this? At the time, this is like 2015, it didn't exist. So I was looking for a Black perinatal mental health practice and it didn't exist. So I just said to myself, well, I have to create it. I also do it because I noticed that a lot of the Black women that I have served, they suffer in silence. They suffer in silence. Many people say, oh my gosh, it's so talked about now. It's still not. So a lot of people suffer in silence, and a lot of us don't know what to say, who to seek out to help us advocate. And then I also love doing this for the community, because we have some great professionals in this community. So that's really what has inspired me. It's like, historically, Black women have shown up for everybody else, but who's showing up for us?
Awesome. Thank you for that. Sometimes it's definitely from our experience that we start things and really do the work. Dominique, you have the floor.
Thank you, Christy. As Siobhan said, I started this work from my own personal experience as well. It was when I began my journey to motherhood that I became interested in maternal health. I'm not, I didn't know what I didn't know, right? So I knew for a long time, ever since I was a little girl, that I wanted to be a mother. But it wasn't until I began my own journey that I learned about the disparities with our health outcomes. And when I was talking to family and friends about my goals for my birth, I wanted a doula, I wanted an unmedicated vaginal birth. They thought I was crazy. But when I heard their stories, they didn't sound like anything that I wanted for myself. So I hired a doula. I had a beautiful birth, didn't think anything about it, had another birth, very beautiful, very uneventful. And it was then that I was like, oh, maybe it's something to doula care. And maybe this is just what I've been longing for. So I decided to become a doula to help more Black and Brown families have more positive birthing experiences and to do my part to reshape our narrative. And in my journey, even though I had three beautiful, uneventful births, in between those, I've had losses. So I understand the need for doula care for good experiences as well as for those that may end in a loss.
Thank you. Thank you for sharing that. Hadassah?
I want to echo what you said earlier about the introductions and everything. Y'all are all gorgeous. Thank you for being here, everybody. I kind of decided to follow this pathway to be a support person for people who are having these kind of life experiences. Similarly to like what Dominique said, following the birth of my child. So I gave birth 21 years ago, and I was the first one out of my peers to have a child. And, I remember the lack of childbirth education I had, and I felt like I went to the hospital and got the number 3 special, get epidural, boop, boop, boop. You just do what they say. And I didn't realize that there were options. So following my, several years of working with mentally ill adults in transitional living facility, I realized that while I enjoyed supporting people who need additional support and I had that capacity, I did come across an article, probably in the New York Times or something, that shed light on the disparities for healthcare in New York specifically. At the time, I was still in New York, and I was like, I'm volunteering all the time outside of work. I'm working in human services. Like, who else do I want to support more than people who look like me, who've had shared experiences than like me? That encouraged me to train professionally to do what I had already done for some of my peers, supporting their life experiences with their reproductive health, whether they were growing their families or choosing not to. So that was kind of what led me in this path, and understanding that within the system, there are different ways that you could provide support. So after becoming a full spectrum doula and going through several different trainings, I realized I had the capacity to be an option for people who wanted to birth outside of the hospital system and support them that way.
Awesome. Thank you for sharing that. And like I asked early on about how do y'all, folks that are on, how did y'all hear about it? Was it through social media? Was it somebody you know? This is a small community, right? In especially in the Black community, but it's also kind of big, right? Real quick, Hadassah really was. She was my postpartum doula, but I knew her from, she was referred to me for my birthing doula, who also knows Dominique. So it is definitely a small world. And so again, I'm glad all of you all are here. Thank you so much for sharing that part of how you all got to this space. So ladies, in the work that you do, and y'all kind of said it, but just go a little bit more in, how do you support families who have experienced pregnancy and infant loss? Why is it important that we continue to speak up and promote Black maternal health?
Can I go?
Yeah, I was just go ahead.
So pretty much like, why is it important, and why do we continue to do it? One, like I mentioned earlier, there's still a lot of stigma around it. Just having my own, just being on the job and having a colleague that miscarried on the job, but the person's response is, you got to keep going, you got to keep working. Like, and this is at a clinic. And then also just seeing a lot of the shame, and also a lot of how society doesn't affirm and validate these losses. It's kind of like, oh yeah, girl, you had it, well, you can go and have another kid. And it's kind of like, well, I'm grieving the loss of this one because I was really excited about this one. And so I do the work that I do because our community needs a lot of education on just how to support individuals that have suffered pregnancy and infant loss. We need a lot of education on reproductive health for our community. We also need to also provide more education and support for partners that are going into this realm as well, because I mean, they're right there, and many of them are traumatized. And so the other reason why, especially somebody that specializes in reproductive psych, even if you look at the number of reproductive endocrinologists in DC and Maryland, it's dismal. It's dismal. You go to the American Society for Reproductive Medicine to look for us, dismal, right? So at the same time, it's kind of like, it's not kind of like, it is. We're experiencing oppression when we're trying to become parents. And we also are not having culturally informed medical care in that realm to affirm those experiences. And I also do it because there's women like myself who has gone through many cycles of fertility treatments, and I don't have an earthly baby, but many of us are ignored and excluded from conversations. But our experiences are real and they're valid, and people just need to learn how to hold space.
That's good. I like that, holding space for the partners, all in what you just shared. So thanks for saying that. Go ahead, Hadassah.
Thanks for sharing that, Siobhan. Some ways that we can show up for people, as doulas, as midwives, we get to offer to them if they want us to attend any appointments with them, or, just like that's how a way that you can hold space with them in person, listening to their individual needs. Everybody grieves differently. So that's really important, asking them what they need. And also, we talked about community earlier, and same thing like Siobhan, I just met her in person recently, but she's somebody that I've referred many of my clients to because we're all networking. We have already identified who are trusted people in our community, because unfortunately in this birth work, there is life and death. And sometimes, we just have to be prepared for that. And it's not something that gets easier to support. So as birth workers, we take care of ourselves as we take care of our families, making sure they're eating. It sounds very minimal, but like I was just messaging somebody a while ago who potentially might be experiencing this. And they're, in that meantime, finding ways to make sure that they're praying, taking care of themselves, talking to their partners, and allowing them to process it with you.
Thank you for that.
Mm-hmm.
Dominique?
Thank you, Hadassah. So before I go into how I support families, I just want to take a few seconds to kind of define the terms, because we're talking about pregnancy and infant loss. And I know we have a lot of birth workers on the call, but for those who might be listening in later who aren't that familiar with the space, I just want to, so you have a miscarriage, which is before 20 weeks gestation, and then you can have a stillbirth, which is 20 weeks to term, and then you can have an infant loss, which could be a loss after a baby is born. So the care that you will provide for those families may look different depending on the type of loss that they experience. I do this work because it's needed. I do this work because I've had my own losses and I understand the heartbreak and the devastation. I understand how isolating it could be, how low you can get. As a doula, what we do is we provide emotional, so that's holding space. And sometimes it's not what you say, it's just being there and letting the clients know, or whoever it might be, your family member, know that you're there, like you're there, and being okay in that silence. Or it could be informational support, so understanding what's next. So I had a miscarriage, and now what does that look like? There's no heartbeat. What does that look like? Understand, taking the time to explain to them that, you have to deliver the baby and it can look differently. And you have options for how you want to deliver your baby. You can still carry out your birth plan to some degree. It can still look peaceful. We can still have music. We can still dim the lights. You can still have your affirmations. You can still birth unmedicated. You can still get in the shower. You can still do the things that you wanted to do. It also looks like physical support. So if you're choosing to have an unmedicated birth, the same things that I would do for someone who was going to birth a living baby is, I can do counter pressure and get you moving around and squatting and those types of things. And I think I'm hitting on all of the things that I wanted to touch on, but this is really, I thought this was raw for me because I had a loss from a family who had a funeral last Friday, this past Friday. I think it's Monday. I don't know what day it is. But I also just left the hospital with a family who had a loss today. So I do this work because pregnancy does not always end in a baby. And those birthing people want and deserve care. So that's why I do this work.
Go ahead. Thank you. Thank you, Dominique, for sharing that. Siobhan, you want to say something? Go ahead.
Yeah, one of the things too that I wanted to mention is touch on two things. The why. I see that one of the other reasons why I do this work, there are birth workers that need to go to therapy themselves, not for the obvious, not for the traumatic births, but some people need to make sure that they've come to peace or had some closure, some acceptance with their own personal histories with birth and birth trauma. And then the other thing is, while Dominique talked about the different types of losses, I know I made a post about this earlier in the month. I wanted to add to some of the other types of pregnancy and infant losses. So there's chemical miscarriages, there's ectopic pregnancies, there's neonatal death, there's terminating a pregnancy for medical reasons. So those are some of the other ones. And then of course, there's some people who labor, they deliver, the baby is home and is alive. And then unfortunately, a few weeks later, they pass. So there's a far range, right? And then there's also adoptive parents. There are adoptive parents that are also suffering from loss because perinatal mood anxiety disorders, they don't discriminate. They can impact adoptive parents. They can impact men. They can impact individuals that have miscarriage and had miscarried or had these different types of pregnancy and infant losses. And so I just wanted to make sure that I shared that as well.
If I may, I don't know if this is a question that some folks who have joined may have, because sometimes I still have a why, right? Because I experienced loss before freedom. I experienced a pregnancy loss at 5 months. So for the panelists, and this might be a broad and maybe hard question, but like specifically for pregnancy loss, is there a reason doctors can't explain, and why is it happening so much in the Black community? And I know it happens worldwide, right? But we also know that it happens a lot in our community. Can y'all sort of answer that question, if it makes sense? And whoever wants to go first.
So there are some things that may help give insight to some people's experiences, depending on um, the maybe the amount of miscarriages or losses that somebody has experienced. There, it's usually going to prompt like midwives and your provider to encourage you to consider genetic testing. And it's not just the person giving birth, but also their partner as well, or whoever, the co-creators of this being. That can give some people some insight. Unfortunately, it doesn't always give answers. There can definitely be a thought that some of the reasons why in our community we may have higher instances of this is because there is a lot of studies that show that sometimes we don't have the access to good health care, we don't have access to good food, or there are many different things that can contribute to pregnancy loss, specifically, like things like gestational diabetes and malnutrition. Those kinds of things do increase the prevalence of seeing these kinds of losses, but they don't explain, like those two things that I just shared, those aren't going to be the explanation for everybody's experience. So I'm just putting that out there. That's just one perspective, but it could be lifestyle, it could be stress, it could be genes. There are many potential factors that can lead to loss.
I wanted to add, thank you, Hadassah, for that. You hit it with the genetic testing, but there are a lot of unknowns. And I was just on the Hill advocating for some legislation to be passed to allow more research and data to go into the reasons behind stillbirth, in particular, that type of loss. So there are organizations who are working to advocate for legislation so there can be more data collection and research done so we can get more answers to the why.
Thank you.
One of the things that I was also going to contribute, one of the things I've learned from my work in repro psych is sometimes, unfortunately, Black women, we have pre-existing reproductive health issues that we don't know anything about. I've had, until we were pregnant, I've had a patient that they wanted to be a mom, and unfortunately they had several miscarriages. And then I realized, I just happened to ask her one day, like, have you done a fertility workup? Have you seen a reproductive endocrinologist? And she said, my insurance doesn't cover it. I said, what? So I made sure I contacted an insurance case manager that worked with her, and I said to the case manager, this woman is going to try again, and I'm scared that she might die. Is there any way that we can have some type of pre-auth for her to get these services that she needs? And sure enough, she got the pre-auth. And what did she find? That she had a pre-existing reproductive health issue from years prior, that had it been addressed like a lot earlier, that she wouldn't have had. It would have reduced these rates of miscarriage. So that's another thing I don't think that individuals are aware of. There are a lot of us that we over trust our OBGYNs. It's kind of like with psychology. We have people that really need to see a psychiatrist or a reproductive psychiatrist, but they keep heavily relying on a primary care physician or an OBGYN, right? And so you get a lot of cherry picking of the care, and things don't happen. Also, but part of that is also due to, intergenerational systemic oppression of Black individuals. And so for me, what I'm observing is that, one, we still have Black women that don't know how their bodies work, and they have kids. They don't know how their bodies work. I just want to repeat this again. They don't know how their bodies work. So I think that, like, we also need to look at that. Like, how can we do a better job of educating all women, right? No matter where they are in stages of phases of life. I just did a panel last night, and many of the women were of menopausal age. They had a lot of questions about their bodies, right? And so we need to have more education on our bodies, because sometimes education allows us to advocate for ourselves. Sometimes systems work if we know how to use them. I myself brought a fertility doula with me for my fertility workup, and it pissed my white physician assistant off. It was wonderful, because my doula knew to ask questions that I didn't know how to ask, right? And come to find out, it was like, oh, you need to test these things and look at these things because it can come with this percentile rate of miscarriage or this percentile rate of a deformity. So I really do believe that we need to do better with our reproductive health. Don't just stop at your OBGYN. Really look at going to a reproductive endocrinologist. We need to also advocate for better equitable health care, because a lot of the legislation is targeting Medicaid only Black bodies, and every Black body doesn't have Medicaid, and Medicaid still has a long way to go in private insurance too. And I also have to say the other lens of oppression that I see that I feel like we sometimes miss in these spaces, us Black birth workers, we experience racial oppression too. And when we experience that, that also impacts and minimizes our ability to be able to show up and support the patients that we provide. Whether it is, the Black NP that's fresh out of school that needs to have a doctor precept, and that white doc is sitting up there precepting everybody else but her. That takes away from her ability to be able to help save lives. So we're all fighting against the same systems. And I think that that's also a big barrier and why we're seeing those stats. And by the way, I put links to some stillbirth cards from the Star Legacy Foundation in the chat. So you can see DC statistics, you can see Maryland scorecard, and then you can also see the national scorecard for where DC and Maryland fall.
Thanks, ladies, for sharing that. It was a little pivot from the question that you had, but I'm pretty sure it was good information. So I appreciate that. And Siobhan, I'm going to stay with you and kind of go around from our questions. But for you, Siobhan, and if y'all want to chime in, please do. What barriers do Black individuals and families face when seeking mental health support after experiencing pregnancy or infant loss? And how can Black mental health clinicians help break down these barriers to ensure equitable access to care? And you kind of broke it down, but can you share a little more?
Yeah, no, there's definitely more. One, I know Simone can tell you, I'm a big advocate of like, okay, make sure that you are not cherry picking your care, right? So, actually, hold on, wait a minute. I had my thought and then I forgot your question. Can you repeat it one more time?
Sure, not a problem. What barriers, this will go away. What barriers do Black individuals and families face when seeking mental health support after experiencing pregnancy or infant loss? And the second part of that is, how can Black mental health clinicians help break down these barriers to ensure equitable access to care?
Okay. So first things first. So the barriers that we pretty much face is, again, we don't have enough Black mental health clinicians. We don't have enough Black midwives. Like here in DC, I think we have less than 5 Black midwives. That should not be. That really pisses me off every day. So that's a barrier too, because part of having culturally informed care is not just being treated by a Black body, but by a Black body that has also taken the time to learn culturally informed practices. Midwifery was us. Doula stuff was us, right? And so a barrier with that was just, it's become, what's the word I'm looking for? It's become something that has become much more sterile, because we're in a safe space with family here. We have white individuals overtaking a field that we created. So that's another barrier. Another barrier too is stigma and lack of education. The number one thing that I hear is, I don't have the time. I don't have the time. I don't have the time. And then also, what our priorities and what our values are. I might say some things that might upset some people here tonight, but I know it's all love and family. If you're willing to put aside some money for some hair, some nails, to go to the Beyonce concert, then you can actually be, you prioritize your money to get a doula. You can prioritize your money to use the Black midwifery practice that's out in Northern Virginia, right? These are things that save our lives. The other thing is, many of the things that we are meant to have, it is advertised to us as a luxury, and it's not. It's our right. So what can mental health clinicians do to break down some of these barriers? One, again, I know Simone can vouch for this. Please, 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 please go to a perinatal mental health training or two via Selene Institute or Postpartum Support International. There are other places that do that. Mass General Hospital, they have trainings as well. They're pretty good. And so definitely do that, because I know what it is to have consultations with clinicians that have not had the perinatal mental health training, and their first thought is call Child Protective Services. And really, if they took the time to understand the difference between postpartum OCD and general OCD, postpartum psychosis, and the staggeringly low rates of postpartum, are pretty much suicide, then they would also understand that, like, mom is scared of this. Mom doesn't want to have these thoughts. It doesn't mean that she's a bad parent. And so we can only adequately support our clients, just what we're taught in grad school, for what we are trained to do. And when we participate in methods in which we're not trained in, we're pretty much reinventing the wheel of oppressing the people we're here to save. So that, to me, I think that's another barrier. We need to go to the trainings. It's okay. It's okay if you're working full time for somebody. It's okay for you to use your employer's money to reimburse for those trainings. Okay. I'll be honest. I took your former employer, Christy, I took their whole Rolodex, all of it, like the G Drive, all of it. So don't be afraid to do
And you
those
should.
things.
Right. Yeah, thanks for sharing that. I do have a question for Dominique and Hadassah, but do y'all want to chime in with what she said, or just go to y'all's question? We're good? Okay, I'm gonna go. Thank you, Siobhan, for that. Prioritize, y'all. And I hope y'all taking good notes. I feel like a lot of y'all in this room are doing this type of work, or you know somebody that's doing this work. So that's helpful. Again, share, put your comments and questions in the chat. How can Black midwives and doulas work to ensure that Black people and families receive culturally competent and supportive care throughout the entire pregnancy journey, including during times of loss and grief? And Siobhan, y'all been talking about it the whole time, but Hadassah and Dominique, can y'all add to that again? How can Black midwives and doulas work to ensure that Black people and families receive culturally competent and supportive care throughout the entire pregnancy journey, including during times of loss and grief?
I'll go. I think conversations like this is key. So talking about the issues, raising awareness around the disparities that exist. I'm a, what is it? I am, y'all, I had a long day. So I am an ambassador for the Earth app, which is like a Yelp-like platform for Black birthing families to be able to find safe birthing facilities and doctors and hospitals and things like that. So knowing where you can get good care is key for families, as well as where you should stay away from. So I think that it's important for us to encourage our clients to utilize that platform, that app, to find care, as well as to report on their experiences. And then as doulas and midwives, we can also leave reviews based on our experiences.
Thank you for that. Hadassah?
Yeah, thank you. That was great, Dominique. Additionally, like I kind of said before, looking from community midwifery specifically, they tend to have smaller volume. So they do have the opportunity to make these connections with other providers who they are likely to refer their clients to. And because I think in all aspects of life, prevention is better than cure. So just like when our clients scrambling in the middle of the night trying to solve a problem, we're not trying to scramble in the middle of a lost situation to find the right person and the right resources to connect our families to. So there are some ways that we either, if we don't know, because learning is a continual process. And sometimes we come across something that we have not experienced yet. It's very unique. So reaching out to other birth workers in the community, other, therapists in the community and say, I haven't experienced this kind of a situation yet. Can you point me in a direction? I had resources that address this, but I need some support. So it takes a lot of acknowledging what you are capable of and not standing in the way of how you can show up for the family who really needs the help. That's important. You have to leave your ego out of this work. And the only way we're going to be able to help our families is being better together. And that's why I'm like really, really grateful to see these faces, because I know that these are people who are doing the work constantly. And they're in connection with other people who are doing the work. And some days we need a day off so they can point us in another direction when I need to like tap somebody else in.
Awesome. Thank you. Thank you for that. So I'm looking at the time, but there's so many good questions, and this is a great conversation. And so this is one that anyone can answer. So it says it's Black midwives and doulas, but really just as Black maternal health, the work that you all do, what strategies can be employed to address racial disparities in maternal and infant health outcomes and reduce the incidence of pregnancy and infant loss within Black communities? Hadassah, you spoke a little bit about it when I asked the question, why is loss happening so much? But what are some more things we can do? So again, what strategies can be employed to address racial disparities in maternal and infant health outcomes and reduce the incidence of pregnancy and infant loss within Black communities? And anyone can start, whoever has something now.
Because a thought came to my head and it will leave real quick.
Go ahead.
So I think, specifically to midwifery and many families who I've even worked with as a doula, a lot of people who come to me, not everybody, many people seem to be low risk, but there are some high risk situations. And for people who are in an out of hospital setting who happen to be low risk, one of the foundations of like midwifery support, it's completely opposite of the hospital system in the fact that you are supporting nutrition, supporting your mental well-being, supporting like the whole person. It's a very human-centered thing to do, as opposed to like in the hospital system where you tell them you have an ailment, they're going to prescribe something, as opposed to getting to know like, do you have stresses in your life? So I think, Lord, I lost it. Now you got me the question again.
Do I need to repeat it for the other two, or don't need to? Is that a yes?
Yes, I was going
it was a long question.
I don't know, child. That's why I said, let me get up on it.
I think I remember the question.
We're talking about strategies that can be employed to address racial disparities in maternal and infant health outcomes and reduce the incidence of pregnancy and infant loss within our community.
So first things first, please include mental health. Like really include mental health.
Absolutely.
I know we have a lot of social workers on this call as well. I said this at the March of Dimes last month when I spoke for them. I've gone to many birth work conferences. They can't tell the difference between a psychologist, a social worker, a counselor, and an LMFT. I've gone to many mental health conferences, and they can't tell the difference between a doula, a midwife, an OBGYN, right, a lactation counselor. So, and the reason why I'm mentioning this is because I feel like once we can really figure those things out and stop having a division, like if I go to one other thing where there's maternal health and it excludes mental health, I'm going to scream. Your mental health is part of your central nervous system. You can't exclude that, right?
We have self-care and mental health question in there, Siobhan, so absolutely.
Yeah. So I think for me, that's what I think just needs to be done, is that we need, every time we go to like CBC or any Black reproductive justice thing, don't have it without mental health. Don't just have a survivor there. Have a survivor, have a doula, have a midwife, and have a therapist.
Siobhan said, invite me to the room, please. That is what she's saying. She needs to be in the room. And real quick, plus you said it, and I'm not going to assume that everybody knows the difference, because I have so many friends that's like, well, what's a doula and what's a midwife? So either one of y'all can answer that question, and literally just the difference, the definition between what's the difference between a doula and a midwife. Who wants to take that? And then Dominique, we can go back to the original question. Go ahead.
Doula is a non-medical professional who provides emotional, informational, and physical support and comfort to families throughout their pregnancy, birth, and postpartum period. So before, during, and after you have a baby. And I like to say we're kind of like a birth coach. So we talk to you about what your goals are, and we help you achieve those goals.
Yep. Midwife definition. Vanessa, you want to get that one? Yes.
Sure. The word midwife means with woman. So for many people who are going through reproductive changes, many of them do identify as a woman, and they are usually supported by a medical professional who can be a midwife. So a midwife is trained to provide in an out of hospital setting, low risk birthing people, primary care. Okay.
Okay.
All right.
Yep. And Dominique, did you want to talk about the strategies that can be employed, or?
I did. So I
Okay.
was
Yes,
going
ma'am.
to say, we've touched on it, but I'll reiterate that education is key, right? So with education, when you understand what birth could and should look like, when you understand the different types of losses and the warning signs and things like that, you can better advocate for the care that you deserve. And we didn't talk about it, but one of the ways that you could prevent stillbirth would be to understand your baby's normal movement patterns by kick counting. There is a free app called Count the Kicks, which helps you identify your baby's normal pattern. So if your baby is normally active when you lay down at night, because you've been moving around, swaying them, rocking them to sleep all day, when you get into the bed and you lay down and you're still, if your baby is normally active during that time, they say choose the time that you know baby is going to move and track at least 10 kicks. And when you're tracking, you're paying attention to the frequency and the strength of those movements. So if your baby is less active or more active, the app will let you know that there's a change. So just understanding your body and your baby can help you, in some situations, can help you identify when there's a problem.
Gotcha. Thank you. I'm going to go to Hadassah. Did you want to say something?
I'm
or
sorry.
Dominique, go ahead.
I also wanted to add, it's important to have conversations, even though they might not be easy conversations. So frequently, I feel like we shy away from talking about things like loss because we don't want to jinx it. So it can contribute to under education, which can just exacerbate the issue.
Yeah. That's good, because for me, I'm going to say, if y'all don't mind, for me, after my loss, I went into whole research mode. Like, I was just like, what's happening? I felt like the doctor dismissed my pain, dismissed everything. So I was reading a lot, learning a lot, asking the questions. And that's really why I got a doula. Did I think I could afford it? No, but I was like, no, I'm gonna get this doula. So I think research, thanks for saying that we got to research. We have to talk about it. We can't make each individual person share their personal story, but if you're gathering the education, you can share with other folks, right? And just advocate.
Talk about it. We also need birthing families to understand that if you have a problem, you should call your provider at any time. I feel like so frequently we're like, oh, we don't want to bother, or, we think it'll be okay, so we're going to look it up. No, pick up the phone, call your provider, go in and get seen. Advocate for the care that you deserve. So when you understand the role of your provider and that they have on-call periods and someone should be there at any time of day, no matter the day. So don't wait till the morning, don't wait until the weekend is over. Call.
Yes. Because we speak in the Black community, we speaking up so much about where you can and cannot take me on the first date. Can we talk about birthing justice, please?
So telling families that they don't need a doula or that they don't need to waste the money on that because women have been birthing since the beginning of time. Can we stop? Can we have real conversations about things?
Can we normalize doulas, please? So yeah, no, thank you for that. I wanted to, so a couple of things. Simone has put in the chat a lot of resources that that y'all have talked about and that y'all have shared. So we're putting it in there. A couple of more questions because I am mindful of time because we did start at 7. But here's a question from LaShonda. What assistance can be provided to high-risk women? A miscarriage sometimes makes OBGYN give you the label. How can doulas and midwifery support those women? So what assistance can be provided to women who are at high risk? And how can y'all support those women? And either one of y'all can answer that.
I think first things first, what are the supports that can be provided? I can't stress this enough. Like, somebody asked me earlier about what did I mean by cherry picking. Well, one, you got to stop cherry picking. You got to stop only just going to your OBGYN for your psychiatry care, for your fertility care, for your high blood pressure, because it actually backfires. It doesn't help you at all. And so for me, I just really feel that like we really do need to take the initiative and stop being scared and go to the appropriate professionals that can help you. I hear a lot of people saying that they want holistic births, but then like they don't go to a midwife, right?
Mm-hmm.
They don't incorporate a doula, and then they get mad that they didn't have the birth that they were seeking. So I think that we just have to really be
Don't be
brave.
scared about the pregnancy journey you want to have, because you do have to incorporate those things for that experience. Because it could be in some hospitals what they see fit, and especially for Black people, they will do it for you. So
Yeah,
you have
and
to
I've also been a part of mom's birth team meetings. Like I've had moms that were just like, listen, I had a birth last time and I didn't like it because this person, that professional, they weren't getting along. And so I've had meetings with both my clients and members of their birth team. So everybody's all on the same page of what does the client desire and what are they seeking. Doesn't mean that it's going to go exactly the way they want to. No, that baby's going to come into this world how they want. But everybody has an understanding of what this patient wants, and the patient has a clear understanding of what their rights are and what they can request.
Yep. Dominique or Hadassah, did you want to answer some of that question about what assistance can be provided to high-risk women?
Absolutely. I think advocacy is a word that gets used very often when people are seeking birth workers. And it's a word that I have very mixed feelings about because people want to rely on their support team to advocate for them, but self-advocacy is super important. Doulas and midwives they encourage and empower families to be self-advocates. So they are, one of our favorite acronyms is the BRAIN acronym. That means, you can apply it to anything in life: buying a car, having a baby, anything. What are the benefits of this situation or my option as presented to me right now? What are the risks of this, option? What are the alternatives? What does my intuition say? And what if I do nothing now? Those things can be applied to a loss experience. When your provider is talking to somebody who's high or low risk, and they're saying to them like, okay, now that we know this is where we are, here are your options. And that's how, and your doula and your midwife can walk with you to make sure you have evidence-based information and that you are thinking about what this is going to look like for this situation and potentially in the future, so that's one of the ways that we can do that. Midwives, we have the midwifery model of care that includes like person-centered, and doulas. We love working with our families because there is this level of continuity. You're seeing your provider for maybe 10 minutes of time. Even in the most uneventful healthy pregnancy, how many minutes are you actually seeing with the person who ends up catching your baby? But you've spent significantly more time with your doula or your midwife, especially in a low volume practice. So having that trust ahead of time, having that person who you've already vetted that's potentially kinfolk, you know, because that is also important. And you know that this is a safe person that I can process this situation with. I can ask them questions about my understanding for the information that's presented. And I trust their professional experience to help me make my decisions.
I have
Thank you.
one.
Yeah, Siobhan, I was about to give you the floor because I think you have to go. I wanted to whatever you're gonna say, you can say, but I also wanted to okay, DC Streets. Sorry, y'all. Hold on. What support do you need to continue this work, and do you have any affirmations in whatever you were going to share before you left?
Okay, those are three long questions.
I
I'm trying to
know, right?
remember it all. So what supports do I need? One, gonna get to the point. Many of us want to be private practice owners, right? And they want to be successful private practice owners. I understand that maternal health is a big thing right now. It is, it always has been, it's not new, right? How you can support, thank you. All right, Hadassah. If you really want to support us and make sure that our people have the support us, meaning pay us to come in and do your trainings, pay us to actually do your resources. Just because we're friends of, sorors of, cousins of, colleagues of, doesn't mean that you just volunteer the stuff, because you're actually burning people out. That's it. I just want to make sure I put that out there. The other part to your question, I'm trying to remember because it was a three-parter.
Affirmations and whatever you wanted to share as you have to go. And we're gonna again time, but I'm not rushing you at all.
I mean, affirmations, listen, not everything that you need an answer for, everybody has it. Sometimes you have to be confident in yourself and understand that if it was brought to you, you've also been charged with being the person to create the change. It's tiresome. It's long hours, days, and weeks. You're going to miss out on some things. But the affirmation is if it's been given to you or charged with you and you keep seeing it, take that initiative. Take that initiative to create the things, because that's the biggest difference. I don't know if you see this at Dawson Dominique, but I feel like that's the biggest difference in the Black maternal health community as opposed to the white ones. We're creating the things. But matter of fact, we're doing like 3-4 roles all at once, right? And it's very common. The other thing I was going to ask is, because I kind of want to know what Dominique and Hadassah's thoughts were. Because I see Candace wrote to LaShonda, I guess, about getting a high risk label removed. And so I'm not a medical professional like you, Hadassah. I get squeamish when I see that, because there are some people that legit are high risk, and like you don't want to mess with that, right? And that's kind of what I mean by cherry picking. It's like, you heard this, but it's kind of like, no, I don't want that, so I'm going to do something else. And I guess pretty much my final thoughts on it are, therapists on this call, PSI has free consultation groups that meet, like they meet a few times a month, and it's free. Sign up for one of those things. If you have a case that really perplexes you, sign up, participate. Sometimes there's 5 clinicians on the call, and then sometimes there's like 30. Mass General Hospital also has they call it the rounds. It's every Wednesday or every other Wednesday. It's it's virtual. So if you are getting your feet wet in this, and this is something that you want to do, read the books, but also participate in the consultation. Pay for the peer consultation and the supervision. It helps, because that's how you build community. And for those of you that are looking for mentors, that's how you get a mentor. You don't get a mentor by walking up to them and saying, I want to know how to do this. Can you show me? You get a mentor by going to the conferences. You get a mentor by actually investing in yourself and paying for the consultation and the supervisions. And that's pretty much it.
And you do have to go, right?
I do, just in a little bit.
Oh, okay. So Siobhan has definitely put her information in the chat. She's responded, and to Candace's question, Dominique answered your question. If you want to, if you need more about that, I really just have the conversation. You got to talk about it. It's okay to talk about loss, right? You won't jinx it. It can happen again, yes, but it's important that you talk about it, seek help for it. That's what mental health therapists are for. That's what Siobhan is for. That's what your doula and midwife are for, your partner, your family. So do that. Dominique, go ahead, because I know you had something.
Okay, I was going to add to Candace's question. So I am a doula, and I have tried to navigate that conversation before and kind of got pushed back. I just had to be okay with you not liking me at that moment, because I have to say what I have to say, because I have a responsibility as your doula to share information and to make sure that I said what I need to say so you can't come back and say you didn't know.
Gotcha. Go ahead. Hadassah, were you about to say something? Nope. You're like, no.
No, I thought Dominique was also gonna answer the questions that Siobhan was gonna say. I was just like,
The question around the last two questions?
like, what do you need
What do
for
you
support?
Oh yeah,
And
I'll ask it again. I'll ask it again because what support do you need to continue this work? And both of you all, please answer that. And then I want to know what would the world look like
I
go ahead.
Oh, hold on. So are we talking about what would the world look like, or what?
Go with what support do you need
Okay.
to continue in this work? Yep.
Okay.
Sorry.
So I think, platforms like this to have conversations and to continue to raise awareness around these issues and these injustices. So thank you so much for having this space. I will also say funding to do the work. I would add a place for birth workers to be able to debrief because this work is heavy. I've had 2 losses in less than a month. And it's not over once you leave the hospital. So I'm, helping make funeral arrangements, going to funerals, things like that. And also to add to that, so some help with like coordination of care, because a lot of times people don't know what to do. My client who was last week, not the one today, she was 17. She don't know how to plan a funeral, so just things like that. So whose role is that? Like coordination of care. Like, I don't know if it's the hospital, but as doulas, things just kind of fall onto our plates that aren't necessarily within the scope of our work, but things that need to get done.
Gotcha. Thank you for that, Dominique. Her information is also in the chat. Hadassah, what do you need? What kind of support do you need to continue this work?
What I need to continue this work, they've kind of touched on it in terms of finances. That is a thing. And the way how that can show up, especially birth workers, we love our people so much. We would climb mountains for them with nothing. And that doesn't help us help other families. And it doesn't even help us when we're helping that family. So the way how my community has supported me previously, so that if I'm supporting a family who I'm not charging for loss, the community has either purchased t-shirts from me, or they'll like pour into my business so that I can provide those services, and I'm not doing it from a deficit, because that's hard. Okay, making sure that we have all of the things that we need so we can show up our full self with these people who are going through challenges. So that's what I need, and if I call anybody, because like Dominique said, I want to debrief and I want to just have a moment to unpack it. I don't feel like journaling. Maybe I just want to get the words out. That helps too. Being able to share those things with other birth workers.
Okay.
So this is where therapist me will interject. So
yes.
One of the things that I have friends that are therapists, and one of the things that we recognize is we all do heavy work. So we ask each other, hey, I want to talk about something, but do you have the capacity to do that? Right. Because everybody doesn't on the same day. Right. And some people, the things that we hear might re-traumatize somebody else. Right. So again, I'm a therapist that has a therapist. She is amazing. And so I encourage everybody to do that. The other support that I did want to add here is like, I heard Dominique touch on the financial piece. Yes, that. But also, we need to do a better job of being referral resources for each other. I'm serious. Especially like just not specific, like not just in the Black maternal health realm, but also in just the mental health realm. Like more, do you know how many of us are not on referral lists for these hospitals? And we should be, but our white counterparts are on there and they're having the grants with Georgetown and GW, right? They're partnering together so that way they can get that grant, right? And so I really feel like what people can do to support me in my work is if you ask me to partner, we're really partnering. You're going to tell me what you're bringing and what you're doing, and you're going to have a clear idea of what I'm bringing and what I'm doing. And we're really going to hold each other to timelines and deadlines for what we're going to be doing together. That's how you can really help me help people. And I think overall, we need to see more of that. Like, I would love to partner with a doula to provide combined packages to clients out there, because I'm tired of having clients that are like, I don't know if I want to get a doula, and I can't force them. But in my mind, I'm like, you need one. You need a doula like yesterday. You understand? Like,
Right.
and so I know that we're the bridge, and I know that if I'm working alongside other birth workers, then our Black patients are more inclined to utilize the things, which is going to lower the risk of, you know, some of these pregnancy and infant loss statistics. You talked about stats before we logged in, Christy, and I wanted to just share some. Those Star Legacy Foundation fact sheets have those stats.
Okay.
DC's Black maternal mortality rate is twice that the national average. We're like in the top 6 in the nation. You'll see in the Star Legacy Foundation for stillbirths. 90% of these births and maternal mortalities are Black people, and 80% of them are preventable.
Yep.
And that's according to the American Psychiatric Association.
Right.
Are there fact sheets that you can share for what is this? Are there fact sheets that
For
you can
doulas and midwife offerings? Are there fact sheets
That's the
that you can
Hadassah
share for
and
doulas and midwife offerings? Do y'all have some? And Shonda, I hear what are you actually asking? Is it fact sheets on what doulas do and midwives, what they provide, or?
Yes, what they provide, what assistance they can provide to families.
I'm gonna drop something in the chat. Just give me a second.
Yep. So that was good. One is we need to support each other. We are not in competition. Share the referrals. And I tell you, the same way I said in the beginning, Dominique was referred by Kim, who could not do the do the panel. So that's how it is. Like, right, if Dominique, Siobhan, or Hadassah are not available for their services, they're going to refer somebody that is available, somebody that they trust. And most 99% of the time, I'm sure that they are Black, right? So just support each other. So Hadassah and Dominique, affirmations. And then for the 3 of you, I know I give y'all a lot at once, but affirmations, Hadassah and Dominique, what you all have. And also just any last words, because again, I am paying attention to time. We could talk a long time, right? But it's a lot of folks on here, and I think they're loving the conversation. But affirmations, Dominique and Hadassah, and then all 3 of you all, what last words do you want to give? It can be some information, another, just some encouraging words, but however you want to phrase your last comment, like we did in the beginning, please do that. So I'm going to start with Hadassah with the affirmations and your last words. You're on mute. Yep.
I apologize. So I thought about these affirmations from after supporting some of the families. And, it's hard after experiencing a loss and being pregnant again and, just getting to the finish line and getting past that week where you were when you had a previous experience. So talking to my families or talking to other families, I'd encourage them to say things like, I forgive my body. My body is doing everything it's destined to do. I'm worthy of being a parent. It's okay to feel this way because it can suck. You know what I'm saying? You got to acknowledge that it can suck. Some days are going to suck really bad.
Yep.
But also, I forgive my womb and it is not responsible for my loss. So forgiveness is big because there are lots of feelings of guilt and shame, especially with all of the unexplainable causes for many people's experience in their loss.
I love those, Hadassah. I love the forgiveness piece. I went with the mindset of helping a family through the loss because that's what I've been doing these past couple of weeks. And I can do hard things. I am powerful. I will work through the challenges as they come. My partner and I are in this together. we will shift and adjust as a team. I can center myself with my breath, and that's very important because, yeah, it's hard. I am a mom. We are parents. So for those who don't identify as a mom, we are parents. Like, we're still parents. Even through a loss, you're still a mom. You're still a parent. And I am supported and loved.
Yep. That is good. Siobhan, because you already gave your affirmation, you can give it again, but any last thoughts that you want to share?
So this one isn't for patients, clients. This is just specific to all of us here. I'm gonna be telling my age here. But one of my affirmations is by MC Light, and it starts off, and she's like, "I am the light." And honest to God, like, we are, all of us on this call, we are the light, and so I just want for us to just be mindful of that and just know that people are depending on us. Also, and we're depending on us too. Like, don't forget who you are when you wake up in the morning and look at yourself. The other thing is, yes, you can also do the hard things. Don't always wait for somebody else to do it. I also put some links in the chat. There's the Black Angel Mom Guided Journal that's created by a Black perinatal mental health clinician that specializes in pregnancy and infant loss, Dr. Janae Hopgood. She's out in New Jersey. I've also posted some links for some support groups. So what can we also do to just support clients? One, understand that grief is not linear. I actually know somebody that she still acknowledges the birthday of her son, who would have been older than me if he was still alive, right? And so don't put time limits on somebody grieving. And also provide permission for that. If these women need to skip baby showers for a year, they can skip it. If these women need to skip, participating in a registry, they can skip it. They don't have to show up for other people, but also being mindful of the self-esteem toll that it takes. I once had a client tell me, and she was glowing and big and, pregnant, like due date in a month. And she was just like, my body's terrible. And I said, what do you mean? And so she was like, my body can't do hard things. If it wasn't for technology, I wouldn't be able to sustain this pregnancy. And so we also have to be aware too of how some moms feel about their bodies and themselves, even though they have produced a live living body. They're thinking about the losses, right? All of that. But again, ways we can support the clients is not always just through therapy. There's also support groups. You can also look at acupuncture, yoga, because they do have acupuncture and yoga in this realm. There's a lot of Black yoga teachers in DC and Maryland that work in the birth space. Amazing, right? And also in the loss space. And also, I'm trying to think. I think, yeah, that's pretty much it. Like, those are just the resources, and of course you can follow me on Instagram because I'm always posting those resources. Thanks everybody.
Yes, you are. Yes. Okay. And Hadassah and Dominique, do y'all have any last words, or were your affirmations good? You have the floor. I'm gonna give y'all a minute, even if you want to take that, and we're gonna wrap up and just thank everybody. And so, who want to go?
I'll go. There are a lot of us on here, and I know a lot of us have our own personal loss journeys. So I just want to say my heart goes out to everyone who has experienced a loss. I'm going to put me a little candle in the chat for your losses, just to honor your losses.
Thank you. Hadassah.
Thank you for that. I want to say, like, I'm very grateful that we're all continuing to do the work. I'm grateful that you all showed up to hear what is being shared, and it seems like you want to be more empathetic and supportive to potentially people in your family, because so many people experience a loss. One of the last things I want to share is there's a very, very low cost training called PALE Advocate Training. It's pregnancy and infant loss training, and NECA Hall has birthed this training from a loss situation. It's her life's work. She's very passionate, and the reason why I want to share this with you is because it's very low cost. And even if you're not a birth worker, it will give you ways that you can support people in your life who may experience this. Sometimes she has it for like as low as $10, $15. You'd be surprised. And it's ridiculous the amount of information she gives for that really low fee. It's worth looking into. Okay.
Awesome. Thank you all so much for those that stayed and the ones that just had to leave because of time. This was an awesome conversation, a needed conversation. I appreciate you all. Thank you, ladies. Let's continue to support each other. Again, I'm Christy Love, president of the Association of Black Social Workers Metro DC chapter. My madam vice president is on Kamika Pope. And really, we want to do things. The goal is to liberate Black people. And we do that through education, advocacy, social justice, volunteer work, all of the things. And so this is one of our ways, panel discussions, to provide a space for other Black folks to share information, share education. And if you want to join ABSW, you do not have to be a social worker, but you do have to be Black and of African descent. All right. Simone is going to put our page. Please follow us on Instagram, right? Or Facebook. It's all the same. So Simone will put that in the chat. Thank you all. I appreciate y'all. We love you all. Dominique and Hadassah, if you want to stay on after we end and stop the recording, but love everybody. Thank y'all for coming. I'll just, you can leave as you want, but I'm gonna stop recording. This is again, ABSW Metro DC chapter. All right. Bye y'all.